Hi all, I'm Malavika, and in this video I'll be explaining leukemia and its classification. Before that, we'll need to have an idea about the process of hematopoiesis, mainly the synthesis of WBCs. So from HSC or hematopoietic stem cell, we have two kinds of series, myeloid series and lymphoid series. The myeloid series will give rise to RBCs, platelets, granulocytes, monocytes and mast cells, whereas the lymphoid series will give rise to lymphocytes. From the common myeloid progenitor, we have myeloblast, and this myeloblast will give rise to promyelocyte, which will give rise to myelocyte, metamyelocyte, band form, and finally granulocyte, which may be neutrophil, eosinophil or basophil. Myeloblast can also give rise to monoblast, which gives rise to promonocyte, and finally monocyte. The common lymphoid progenitor gives rise to lymphoblast, and this will give rise to prolymphocyte and finally lymphocyte. So this is about the synthesis of WBCs. In leukemia, there will be leukocytosis, that is, an increase in the number of WBCs. There will also be an increase in the number of precursor cells. That is, in myeloid leukemia, there will be an increase in myeloid precursors, and in lymphoid leukemia, there will be an increase in lymphoid precursors. In acute leukemia, there will be an increase in the number of blast cells, and according to WHO criteria, blast cells will account for 20% or more of the nucleated cells in the blood or bone marrow. There are two types of blast cells, myeloblasts and lymphoblasts. Myeloblasts are larger cells with moderate cytoplasm and prominent nucleoli. They have OR rods in their cytoplasm. Lymphoblasts are smaller cells with scanty cytoplasm and less prominent nucleoli. OR rods are absent. Coming to the classification of leukemia, according to the traditional or conventional system of classification, leukemia can be divided into acute and chronic. Acute can be further divided into acute lymphoblastic leukemia and acute myeloid leukemia, while chronic leukemia can be further classified as chronic myeloid leukemia and chronic lymphoblastic leukemia. There are two systems of classification for acute leukemia. The first one is FAB or French American British classification. According to this, AML can be classified into 8 types from M0 to M7. AML M0 is minimally differentiated AML. M1 is AML without maturation. M2 is AML with maturation. M3 is promyelocytic leukemia. M4 is myelomonocytic leukemia. M5 is monocytic leukemia. M6 is erythroleukemia. And M7 is megakaryocytic leukemia. On studying the cytochemistry of the cells in each type of AML, M1, M2, M3, M4 and the myeloblast component of M6 are found to be myeloperoxidase positive. M0 is myeloperoxidase negative. M4 and M5 are non-specific esterase positive, and the erythroblast component of M6 is PAS positive. PAS stands for periodic acid shift. M7 is platelet peroxidase positive. AML M2 is the most common type of AML. M3 is associated with disseminated intravascular coagulation, and M7 is the most common type in Down syndrome. According to FAB classification, acute lymphoblastic leukemia can be divided into 3 types, L1, L2 and L3. In L1, small homogeneous lymphoblasts with scanty cytoplasm and inconspicuous nucleoli can be seen. In L2, large lymphoblasts with variable size and large nucleoli can be seen. In L3, large homogeneous lymphoblasts with basophilic and vacuolated cytoplasm and prominent nucleoli can be seen. Coming to the WHO classification of acute leukemia, acute myeloid leukemia can be divided into mainly 4 types: AML with genetic abnormalities, AML related to myelodysplastic syndrome, therapy-related AML, and AML not otherwise specified. Acute lymphoblastic leukemia can be divided into 2, B-cell neoplasms and T-cell neoplasms. Each can be further divided into 2, precursor cell neoplasms and mature cell neoplasms. So that's all about leukemia and its classification. Thank you for watching.